Hi, my name is Dr. Helen Liebling. I'm a clinical psychologist and also an associate member of the African Studies Centre at Coventry University, and I'm also one of the co-founders of African Psychcare Research Organisation, who do research and training and consultancy in regions of Africa where there are war torture survivors and survivors of sexual and gender-based violence. And I'm going to talk to you today about a project we recently carried out on the experiences of trauma counselling services in Kitgum and Gulu, northern Uganda, and also the implications of this for mental health policy and legislation. We carried out this in close collaboration with Kitgum Women's Peace Initiative, who are an organisation who are involved in peace building and also reproductive health service provision for women and girl survivors. And the reason this research is important is because mental health was omitted from the Peace and Recovery Development Programme for Northern Uganda, and also we carried out a previous study with former child abductees of the Lord's Resistance Army, and we found the mental health needs were many, but there was a lack of service provision for those who were affected. This study has not been carried out in the East African region, and there's a pressing need to understand the importance of the mental health policy and legislation implications. So we carried out a qualitative study after obtaining funding from the British Academy and Leverhulme Trust, and we gained ethical approval in both UK and also in Uganda. And in total we carried out 35 in-depth interviews using an interpretive phenomenological approach, which looks at really the sense and the meaning participants give to their experiences, because we wanted to get in-depth knowledge of these, both from the providers and also from the survivors' point of view. So we interviewed 10 men and 10 women survivors and 15 service providers. And in terms of the results, we found that those survivors who were already traumatised were further traumatised by the increasing number of land conflicts in northern Uganda. And in addition to this, the trauma was exacerbated by the fact that there was a lack of access to justice or basic needs after the atrocities they'd gone through. But in terms of the services they accessed in the trauma clinics, survivors generally found these beneficial. They found the combination of receiving medication and an option of group or individual counselling helpful, and a person-centred approach that was being used was found to be valuable by survivors. But unfortunately there was an inconsistency due to a lack of resources, and there was a variation in terms of skills and ability of the counsellors and also the counselling provided. And sometimes the medication supply was erratic, which meant that survivors could relapse. In terms of the research importance and the policy recommendations, we would support the Ministry of Health in Uganda, who've recommended to provide more mental health expertise at the district level. If this could be done, then training could be provided to increase the capacity and understanding of the effects of war trauma, and also the need for trauma counselling in the rural areas. And it's very important to involve the cultural, local and religious leaders in this work for greatest effectiveness. In terms of the rejection and the stigma still experienced by former abductees, we recommend that countrywide sensitisation using radio and local media would really help to tackle the stigma experienced, and community outreach services, perhaps through mobile clinics, would increase access to trauma counselling services in the rural areas where there is the greatest need. In terms of the next steps, if we had additional funding, we would certainly extend the services to the rural area, but through the use of mobile clinics. But at the moment we're disseminating the research findings in collaboration with our partner organisations in Uganda, through the ministries, through the government and also through policy makers. And we're also presenting the findings at national and international conferences. Thanks very much for listening.